Hello, my name is Genevieve Oni, and I am the co-founder and CFO of Mdaas Global. At Mdaas, we're solving one of the biggest challenges in healthcare in Africa today, which is access to high-quality diagnostic services. We all know that diagnostics play a critical role in any healthcare system. In order to start feeling better and start your road to recovery, you have to first know what's wrong. At Mdaas, we're working to solve this challenge by bridging the gap and making sure that patients, no matter where they live, in big towns or small villages, and no matter how much money they make, can get access to the critical diagnostic services they need to live happy and healthy lives. By 2030 in Africa, deaths from lifestyle diseases like cancer, heart disease, and diabetes will actually outnumber deaths from infectious, maternal, perinatal, and nutritional diseases combined. With that, the population of the continent is growing rapidly, reaching 2.5 billion by 2050. Unfortunately, the existing healthcare infrastructure across the continent is just not equipped to meet these growing and changing needs.
Hello, my name is Oluwashagaoni, and I'm the CEO of Mdaas Global. At Mdaas, we build and operate modern tech-enabled diagnostic centers in clinically underserved communities across Nigeria and hopefully across Africa. We started Mdaas when I was a student at MIT, and at the time, we were looking to solve the problem of how to bring high-quality medical devices to Nigeria, to doctors like my dad. So we started a business importing a lot of high-quality medical equipment from the US, trying to equip doctors like my dad at the time. But a couple of years later, we pivoted the business into diagnostics. And we did this because we saw diagnostics as a really critical part of care. And we saw that most doctors don't have access to the kind of equipment they need to do diagnostics for their patients. We launched our first center in November of 2017 in Ibadan, Oyo State. And since then, we've expanded. Now we have 15 locations across 8 states in Nigeria. Our diagnostic centers provide really high-impact diagnostics such as ultrasound, X-rays, fully automated lab, EEGs, ECGs. 80% of all of the diagnostics that most patients need to get diagnosed before they can get treated, we provide for our patients. And what is unique about what we do is that we're not just focused on in big cities, we're expanding to not just tier 1 cities, we're in tier 2 cities and tier 3 cities. And right now we're also working on models that will help us even get to smaller towns and villages across the country. There are 3 key things that enable us to do the great work we do and makes us really uniquely positioned. Number 1 is our vertically integrated supply chain. That means from sourcing all of our equipment from the US and Europe and China. This is important because it helps us reduce the cost of care for the patients, and it also helps us reduce the cost of setup for our centers. Number 2 is technology-enabled operations. Across all of our operations, we use a lot of technology to enable it, and this helps us optimize how we do things across the centers and makes it easier for us to manage that many number of centers. And finally, we focus a lot on patient experience for our patients. We've seen over 115,000 patients till date, which is amazing. We have done over 200,000 tests. We currently work with over 1,000 hospitals across the country, and we work with all the major HMOs, 25 of them. And we also work with a lot of corporates to deliver a lot of government mandated screenings for their employees. So overall, we have a really large referral network that we have built over the years, which is impressive. Our big vision at Mdaas is to provide high-quality, affordable healthcare for the continent's next billion. And even with everybody we've seen so far, we think we're just beginning. We think across this nation, across Africa, there are many places where getting a basic diagnostic test is still a problem, and we want to keep solving that problem. And so we will keep building diagnostic centers where they need to exist. We'll keep connecting those diagnostic centers to primary care, secondary care, pharmacies, to anybody they need to go to. We will connect those patients with any place they need to go to. We think that this is part of our mandate. We think that this is what we need to do to provide better healthcare for Africa's next billion.